All right, so stenosis, regurgitation, prolapse, that had to do with disorders and dysfunction of the valves in the heart. So now we're going to take a look at several different conditions that are disease or dysfunction of the heart or the circulatory system. So problematic heart's notes. We are going to start with palpitations. So palpitations are when the heart beats too fast, skips beats, or flutters. Palpitations are short-lived conditions. So palpitations are when the heart beats too fast, skips beats, or flutters. It is a short-lived condition. Atherosclerosis. Atherosclerosis is the buildup of plaque in the artery walls. It can damage the artery and increase blood pressure. So this is my shorthand for increased blood pressure. I know that that's what that means. If you don't know that's what it means, don't write that down because you're going to confuse yourself when you come back to study. We will eventually have a picture that goes with this term, so that's what the highlighting goes with. But for right now, we just need the definition. So atherosclerosis is the buildup of plaque in the artery walls. It damages the artery and increases blood pressure. PFO. So the foramen ovale is a natural hole that is in every fetus. And it's just natural in their heart. It allows the blood to bypass the fetal lungs because lungs of a fetus aren't working correctly. So the blood goes straight from the mother to the fetus's heart rather than going to the fetus's lungs. So the foramen ovale is natural. It's supposed to be there. But patent foramen ovale is when the hole remains. So there's a hole between the two atria. It is a small hole, and it's usually harmless, but it allows the blood to mix. So if the hole is too big, or if it doesn't eventually close up, then it becomes a problem. Congestive heart failure. This is when the heart cannot pump enough blood to supply the body. It's caused by lots of disorders, including structural defects, disease, and arrhythmia. Congestive heart failure. The heart cannot pump enough blood to supply the body. It can be caused by different disorders, including structural defects, disease, and arrhythmia. VSD is ventricular septal defect. There's a hole in the lower part of the septum, and that allows the blood to mix. Ventricular septal defect. There's a hole in the lower part of the septum, and it allows the blood to mix. ASD is atrial septal defect. This is a failure of the septal tissue to form, creating a hole larger than the hole for the PFO. This is more of a problem. Once again, blood is mixing in the atrium. So ASD, atrial septal defect, failure of the septal tissue to form. This creates a hole, and it's much larger than the hole in PFO. It's more of a problem allowing blood to mix. Oops. Let's do this. Get the definition first. So it makes more sense. All right, we're continuing with problematic hearts. Myocardial infarction. This is another name for a heart attack. It's a result of the death of heart tissue or cardiac muscle due to prolonged or permanent ischemia. So heart attack, death of heart tissue or cardiac muscle due to prolonged or permanent ischemia. Congenital heart failure. The heart does not work as efficiently as possible. Congenital heart failure. The heart does not work as efficiently as possible. Angina. Angina is chest pain due to ischemia. Angina is chest pain due to ischemia. So momentary loss of blood flow. Thrombosis. Vessels are blocked due to blood clots. Thrombosis. Vessels are blocked due to blood clots. So you can have arterial thrombosis, so it's going to occur in the arteries, and venous thrombosis, so it's going to occur in the veins. Right. So ischemia is an inadequate blood supply. You can have cardiac ischemia, limb ischemia, so it's going to be in the legs perhaps. Mesenteric ischemia could be in the intestines. So ischemia is an inadequate blood supply. An embolism is a blockage of blood vessels due blockage in a blood vessel. There we go. Due to fat / blood clot / air / foreign material that travels until it gets stuck. Pulmonary embolism would occur in the lungs, because pulmonary means lungs. Brain embolism in the brain / retinal area. So an embolism is a blockage in a blood vessel due to fat or a blood clot or air or foreign material, some kind of substance that travels until it gets stuck. Pulmonary embolism, brain embolism, so it depends on where in the body it's at. Arrhythmia, aneurysm, sorry. Skipped aneurysm. Aneurysm is the weakening / bulging of an artery wall. It could rupture and cause internal bleeding, and it can occur anywhere in the body, but most commonly it occurs in the aorta and in the brain. So an aneurysm is a weakening / bulging of an artery wall. It could rupture and cause internal bleeding, can occur anywhere in the body, but most commonly it occurs in the aorta and the brain. And then finally, an arrhythmia is an irregular heartbeat. Arrhythmia is an irregular heartbeat. All right, so a few more problematic hearts that was a part of the new PBS curriculum. We have hypertrophic cardiomyopathy. So the myopathy part is indicating muscle tissue. Hypertrophic cardiomyopathy, heart muscle is abnormally thick. This is usually a genetic issue rather than just an high blood pressure. So hypertrophic cardiomyopathy. This is due to increase in muscle tissue, abnormally thick muscle tissue. The heart muscle is abnormally thick. This is a result of genetic issues rather than just high blood pressure. All right. Oh my goodness. Pay attention to what I'm doing. All right, so Eisenmenger syndrome is an abnormal circulation of blood in the heart due to congenital defects. So they could have a hole in the septum, they could have a dilated pulmonary artery, they could have right ventricle hypertrophy, they could have thickened pulmonary artery, but we have abnormal circulation of blood in the heart due to congenital defect. And we'll come back and we'll look at that term congenital here in just a minute. Bacterial endocarditis. Bacterial endocarditis is when there are deposits left on the mitral valve from a bacterial infection. This can affect the efficiency of the valve. So deposits from bacteria. So bacteria are living things, and so as they go about their life, they're going to leave, create and leave waste products, and those waste products are the deposits that are left on the valve. And so if you've got gunk building up on your mitral valve, that's going to affect how that mitral valve works. Right? Left ventricular hypertrophy. So hypertrophic cardiomyopathy was an abnormally large increase in the thickness of the muscle of the heart. Left ventricular hypertrophy, this is specific, the left ventricle. So the muscle tissue of the left ventricle becomes abnormally thick from having to work too hard. So this one is related to high blood pressure, whereas hypertrophic cardiomyopathy is related to genetics. So left ventricular hypertrophy, the heart is working harder than it has to. Blood pressure is really high, so it's hard for the heart to pump the blood. And so the muscle tissue of the left ventricle becomes abnormally thick from having to work too hard. Coronary artery disease. This is similar to atherosclerosis, but it's specific to the heart's arteries. So coronary arteries are arteries in the heart. We have a buildup of plaque inside the heart's arteries. Atherosclerosis was a buildup of plaque inside of arteries, but coronary artery disease is specific for coronary arteries. All right, so some risk factors for heart disease: high blood pressure, diabetes, smoking, obesity, sedentary lifestyle, so that means that you don't get a lot of exercise, you sit around quite a bit, unhealthy diet, age, the older you are, things just start breaking down. Family history, so if you have a family history of heart disease, then you're more likely to have heart disease. So we saw the word congenital in here a couple of times, and so that has to do with a dysfunction or disease that you are born with. So when we talk about congenital diseases, that is something you're born with. So a dysfunction/disease you are born with. Chronic are long-lasting and continuing diseases. Acute are conditions that are immediate, come on suddenly. So acute is probably more along the lines of palpitations or something like that, because it doesn't necessarily last, but it might come on suddenly. Chronic is going to be a little bit more along the lines of diabetes, something that's long-lasting, you have it throughout your life. Congenital is something that you are born with, so a lot of heart defects are things that kids are born with.